Next, to generalize the basic attributes of etiological factor. How it illustrates the pathological changes. Pathological means disease changes. To generalize the basic attributes of etiological factors. So now you can understand the abnormal factors generalizes the abnormal factors. Please mute your mic. The abnormal factors generalizes the what?
Excuse me, sir. Please mute all the mics from your end.
Dr. Jamal, please mute your mic.
Okay. So the English science with
Can you hear me clearly?
Yes, sir.
Yes, sir.
You clearly.
External and internal. So to generalize the basic attributes of etiological factors, you must understand some pathological changes. What are pathological changes? You must understand TCM in preview with what? Slave disc. TCM in preview with back pain. TCM in preview with HNP. Then it becomes very easy for you to recover a disease. Today I'll show you one case how I recovered. In just 5 minutes of back pain, she was, although having back pain, she was unable to move. From this, like a bedridden, she came with muscle relaxant, but she was unable to move. And today you can see how beautifully she moved. This is how you understand. If you combine both of them, you can recover what? Chronic fatigue syndrome and other diseases in within few days. Otherwise, these are unrecoverable diseases in allopathic science. So, if you understand the basic foundation, you can understand the basic understanding of the subject. So, how to attribute? It is whether in the disease is external or internal, young pathogen or in pathogen. It is because of young or in heat nature diet or cold nature diet. What kind of food eaten? आपने किस तरह का खाना खाया है? excited emotions or inhibited emotions. Now, emotions also play an important role, I tell you, because the emotions are created by the brain. Now, these emotions, brain has two chemical factors, electrical and chemical. So, when you are happy, when you think too much, you suffer from a disease. You are happy, you may have a heart attack. If you are too much happy, if you are too much sad, you may go into depression. And then your courage to fight with the disease goes down. You can understand how in a small period of time, practically if you recover a patient, it becomes very easy that within 5 minutes, you will see the total procedure I've completed in 5 minutes and the patient was moving around, whereby our L5S1 was already compressing and it was extruded disc. Normal experience of yin and yang, abnormal deliberation of yin and yang, mutual deliberation of yin and yang, conversion of yin and yang pattern. To analyze the pathogenesis, you must understand abnormal exuberance of yin and yang. Which is disturbing, yin or yang? Abnormal deliberation, yin or yang? Excess of yin or yang or less of yin and yang? Detriment of yin and yang, conversion of yin and yang pattern. So these are things which you have to understand. This is the basic formula of foundation of TCM. What is the basic foundation? Abnormal exuberance of yin and yang, abnormal deliberation of yin and yang, mutual development of yin and yang, mutual detriment of yin and yang, conversion of yin and yang pattern. Did you understand? Did you understand? Any question here? Any questions? Can you hear me? Hello?
Yes, sir, we can go.
Any questions?
Yes, sir. We can hear you, sir.
Next. For diagnostic methods, young, whenever you will see young disease, bright color, loud voice, surging pulse. In disease, dark and gloomy color, feeble voice, and threat pulse, which we will know later on. These are the four diagnostic methods of TCM. Which are the four diagnostic methods? You can write down. Young or bright color, loud voice, and surging pulse. In dark or gloomy, feeble voice, threat pulse. Pulse is threat. What are the 8 principles? In a young exterior, young, you will see exterior diseases, excessive and heat pattern. So these are the 8 principles. What are the? You will see the exterior disease, excessive and heat pattern. In is interior, deficient and cold pattern. Then you will see young edema, young jaundice. In edema, in jaundice. So there are 4 diagnostic methods. You will see young means I always told you, young was the fundamental principle is what? Young is in bright colors, loud voice, higher voice, and surging pulse. So you can understand hypertension is a part of what? Young disease. So young is controlled by yin. So what are the points we can use? PC6, heart 7, heart 8. These are the points which we can use to bring down the liver 2, liver 3. These are the points we use. Yang is controlled by yin, and yin is controlled by
Yang.
right?
Yes, sir.
Next. प्रकाश जी ठीक से दिखाई दे रहा है? प्रकाश जी are you recording me? Are you recording?
I think it's because a few moments I saw recording is going on.
Well,
Recording.
Prakash is around. He's a co-host. Let me confirm he's still in class. Yes, he's still in class. Maybe he went to the loo or something like that. And his camera is on.
Yes, he is here.
Yin and yang, how to direct treatment, therapeutic principles and methods. Yang exuberance clears the heat pattern. So what do you mean by young exuberance? Can you tell me? So removing the young, excess of young in the body clears the heat pattern. Removing the in exuberance dispels the cold pattern. Young deliberation removes the warm and young. And in deliberation notices the in. So this is the four principles, the therapeutic principles and methods. What are the four therapeutic principles and methods? Young exuberance clears the heat pattern. In exuberance dispels the cold pattern. Young deliberations the warm young, and in deliberation notices the in pattern.
सर
हाँ, आपको आवाज आ रही है? आज ठीक है सब
सर
कुछ?
वो क्या बोल रहे थे रिकॉर्डिंग का?
रिकॉर्डिंग और आज सब कुछ ठीक है? स्टूडियो बना दिया मैंने रूम का।
हाँ रिकॉर्डिंग कर रहा हूँ ना मैं।
अब आपको सब कुछ ठीक से दिखाई दे रहा है?
हाँ अब ठीक है सर, एकदम परफेक्ट।
अब आवाज?
आज आवाज भी ठीक है, एकदम फर्स्ट क्लास है, सुंदर।
मेरा और ठीक है? From tomorrow, I'll teach you on the whiteboard about
Thank
various
you very
diseases
much.
and different methods of understanding different types of diseases in yin and yang. So these are the properties of house, nature, yang and yin. So the nature of the hub is warm or heat, cold or cool or cold, pungent, sweet and bland, sour, battery or salty, sorting and sinking. So as per the balance of the yin and yang, now you should understand this is the basic foundation. As per the balance of yin and yang, you can understand that which kind of balance you have to use. So the most important part of the balance is which kind of herb. Whether it is excess of yang, then you have to use what? Part of the yin. When the yin is less, you have to improve the yang. That is the most important part of the treatment of the disease. Yang has to balance the yin, and yin has to balance the Am I right? But
Yes, sir.
in balances in. For example, I'm having hypotension that day, right? So at that moment, I inserted what? Young pattern. I inserted those needles which improved my heart pressure. And immediately you could see I was discharged from the hospital. Hospital tropopin was required, but immediately tropopin was reduced, and you could see I revived and I came back home. And I have touched my duty. Clear?
Clear, sir.
Next. There are formed five theory of five elements. There are theory of what are the theory of five elements? This is the main component of this one. Understanding TCA. What are the formation of five elements? The basic theories. Write down. Formation of five elements. Concept of five elements. Features of five elements. Classification of things according to five elements. Main concepts of five element theory. And application of five element theory in TCA. These are the five things, theory of five elements we must understand. First, we understood yin and yang. Yang, how yin and yang contributes to the disease. This is the chapter 1. Now, balancing yin and yang removes your from the disease. Now, for example, today a patient came with very severe pain. I inserted two points, inserted and removed, and within 1 or 2 minutes or 3 minutes, you will see the pain was reduced to what? 52?
60%.
Yes. So now I will teach you some practical aspects by which you can recover what? Patience. Some points. First of all, we'll go to Facebook and we'll see how I recovered this slip disc pain. Then I'll explain you how I understood this was to be used. Right?
Okay.
Theory and practical should go together. Then you will understand main part. Right? What are the five elements? You'll understand how five element theory helped me to recover this patient instantly on the table. And today it is the first video. And then you will see how by NIBS we recovered a paralysis patient instantly by the lower limbs. Oh, that is in the video, sorry. That recording, can you see? Okay. Tomorrow we'll upload one Zoom video which you could see very clearly how I have inserted the needle. And today you will see how I recovered a patient of pain. In Facebook, can we go? Then I'll show you how are the points used to recover the patients.
Stephanie from Nigeria, please mute your mic. Thank you.
Can you please go to Facebook? So this is the shape of a slip disc, you can see. This is its shape. Now, this Rajesh who has recovered a slip disc patient. 1 minute, let me check. Yes, it has been posted. Why it is not coming? Please check. It has not come. Just posted a video. Yeah, this video. Pain at L4, L5 area. You can see now in the neural formula there is an encroachment. And she is having it from last 4 to 5 years. एक स्लिप डिस्क की लेडी है जिसको 4-5 साल से सीवियर पेन है. She is suffering from low back pain from last 4 to 5 years, and you can see she was unable to walk, unable to get up from last 1 week.
Unable to stand.
Unable to stand.
And here also there is a lot.
After 5 minutes, if I subside the pain, what will you say?
Thank you.
Right.
Six o'clock I will call the exam, get up because we need to go to school.
Now you see how we recover that in a very easy. That कहाँ से कहाँ हो रहा है?
నొప్పి ఎక్కడి నుండి ఎక్కడికి ఉంది?
ఇదంతా కూడా పెయిన్ ఉంది అండ్ ప్రెసెంట్ పెయిన్ చేసుకోవడం వలన నాకు
अभी पेन कहाँ है?
ప్రెసెంట్ ఇప్పుడు ఎక్కడ అనిపిస్తుంది?
What is this?
अभी नहीं समझ में आ रहा है सर किधर पे मैं बोल रही हूँ.
है ना?
లేదా లేదా
Where is the pain here? Now you came. Where is was the pain?
I don't know.
ఎక్కడ ఉంది పెయిన్? ఇక్కడుంది. ఇక్కడ ఉందా? ఇక్కడ పెట్టిన దగ్గర ఉందా?
పెయిన్ తెలియట్లేదు ప్రెసెంట్. I don't feel any pain now.
అచ్చా నార్మల్ మీకు ఎక్కడ నుండి ఎక్కడ వరకు వచ్చేది?
Actually here it is the pain and then this one.
Now where is the pain?
Because of this pain, she is unable to feel.
No, this is different area. This is different area.
Okay.
This is L4, L5. This is C3 to C6.
Now I don't have any pain.
Over here, you don't have any pain. It has
Yes, I don't have pain, but I'm unable to stand up. I don't have any strength in this area.
You don't have any strength in this area.
Yes, without belt, I'm unable to stand up.
Okay. So she is not able to stand without belt.
Yes.
She is having nerve compression.
Yes.
Vijay cotton देना.
And morning I had one painkiller because of that I'm not feeling any pain.
Now you can say it is duo point or is a live. Everything is live today. He is unable to move from bed from last 7 days. Now you can walk and see, there is no pain. You are unable to walk without the belt now?
Can I stand?
Yes, you can stand, you can walk.
Yes,
Now you can walk.
I can.
Walk fast.
Yes. I'm able to stand and I'm able to
How much comfortable, how much able to stand?
comfortable. And okay, comparatively, I'm very comfortable now. Before
Yeah.
that, I'm unable to stand, and now I'm not feeling any sensation. I mean, ఏమంటారు అది నడుము పడిపోతుంది అన్న ఇది లేదు ఇప్పుడు.
Now
Now I can speak.
She is able to balance now, sir.
She was
Yes.
unable to balance before this.
Before that,
Now you will better, you will get better. 1, 2. Yes. How much?
yes, I'm feeling more comfortable.
Walk. How much comfortable?
How much?
60 to 70% comfortable.
Where is the 30% uncomfortable?
Here, this area.
No.
You talk about only here.
Back.
Back, you are 100%
Yeah,
comfortable.
yeah, no
That's what you
problem.
need to say.
How much uncomfort you are feeling here?
No, I'm not feeling any uncomfortability. I'm okay. I'm
Do
okay.
forward bending and see.
Can I?
Yes. You can do. Yeah. Go. Go.
Here it is pain.
Where?
Here.
Here.
Yeah.
Here.
Little here it is pain.
शास्त्री सर,
हाँ,
ये वीडियो की आवाज नहीं आ रही है.
ये वीडियो की आवाज थोड़ी सी कम आएगी. मैं आपको पॉइंट्स बता दूंगा. मैं बता रहा हूँ. I am showing out that how by NIBS and combination of acupuncture points how I recovered a very critical
But
case
I
with
have
a very
it don't
severe
went
back pain,
forward, so that's
unable to move.
why I'm little bit.
बिस्तर में घूम भी नहीं पा रही थी, दाएं बाएं ऊपर नीचे कुछ भी नहीं कर पा रही थी. She was totally bedridden. Now you can see within 5 minutes on record how she recovered. That is why I said your concepts of 5 elements and why the selection of points should not be based on what? Local
But
prescription.
here little comfortable గా అనిపించదు.
मतलब किसी ने जो लगाया सपने लगा दिया वो काम मत कीजिए. आप बीमारी को सेलेक्ट करके choose your disease and then you will see how you recover the patient.
In this area,
Then I'm going to tell you which are the points I have used.
okay.
After arrival to now, how much?
When you came.
After arrival, she's feeling more confident.
How was she at home?
Yes, she was unable to stand. She was unable to stand. She was unable to sleep. That's the reason we came running.
How long she was having like this?
Almost 4 to 5 years. Subsequently, with the physiotherapy, it gives her some relief, but she was not used to.
Now this acute pain was since when?
This acute pain is almost
5 days.
1 week. 1 week.
5 days. Last Friday onwards.
Now how much subsided?
It's good. 100%. No pain is there. I'm unable to stand up and there.
So you can see within the whole procedure was done on record and she has recovered almost 80% to 90%. You can write down the points. Subsequent procedure with just when did I give the painkiller and all? Just with 5 dry needle and just compression. You could see the patient was having very severe pain. Who could not walk without belt.
Yes. Cannot
Good to
stand up without bed. Now,
You could not stand up without belt.
yes. Now,
Now you can are standing also, walking also, you are forward bending also.
yeah.
You are finding any discomfort?
No.
तो ये एक पेशेंट था जो विदाउट बेल्ट जा नहीं सकता था, सीवियर स्लिप डिस्क पेन था, अनेबल टू मूव, अनेबल टू वॉक एंड इट वाज वेरी एक्यूट पेन. ए केस रेफर्ड फॉर न्यूरोसर्जरी की आवश्यकता थी, बट यू कुड सी पैलिएटिवली द पेन इज रिवाइव्ड एंड पेशेंट इज कंफर्टेबल. Now write down the points. Can you hear me?
Yes, sir. Waiting for the points.
Yes, sir.
Write down LI4, LI11. BL24, BL25, 26.
Sir, little bit speak loud, please.
Can you hear me now?
Yes, sir. Clearly.
LI4, LI11. BL24, BL25. Urinary bladder 24, 25, 26. Kidney 3, kidney 7. SP6. You can see how quickly I understood that this was indeficiency. Tell me, how did I understand? Because there were some patches. She could not sleep in the night for many days. So when you don't sleep in the night, the bones becomes weak. That means she is having pain because of weightlifting and domestic Indian work, and moreover lack of sleep and anxiety. So this was the most important point. She was too much anxious. So what did I do? I inserted PC6 and heart 7, which reduces the anxiousness. Did you understand?
Yes, sir.
What are the points did I say? Can you repeat? Can you write down in the group?
Okay.
LI4 and
LI4, LI11.
LI4, LI11.
BL 34, 35, 36.
Yes.
Kidney 3, kidney 7.
Yeah. And patient got how much relief in how many minutes?
5 minutes.
So this is how you have to produce the results in acupuncture. If your concepts are clear, what can you do? You can recover the patient immediately. A large number of patients can be served from surgery because her disc was totally prolapsed and she was referred for surgery. If she continued this pain for a long time, what would have happened? She would have gone for surgery. Yes. Now you can understand how beautifully you can recover paralysis, how beautifully you can recover with the help of non-invasive brain stimulation. There was some stiffness in the lower back, which I recovered with the help of inserting needle over here, strengthening the muscles, paraspinal muscles, and stimulating the local points. I could do it with other areas also. But now, one thing you can understand in tongue point, Tung did not address these areas. Tung addressed only symptomatic treatment. What did he address in these cases?
Symptomatic treatment.
Symptomatic means only nerve compression. He did not address the nerve compression. If I don't remove the local spasm from there, right? If I don't correct the balance, the pain will what? Immediately come. Immediately you remove the needle and she will not even have relief. So if your concepts are good, you don't even need stimulators also. Your hands are stimulators. But yes, in neuropathic conditions and all, you may need it. But in other conditions, you may don't need it. Now, while recovering the patient, how did I recover? So this was the area of the spine. So what did I do? Can you see?
Yes, sir.
Inserted the needle over here. It's a trapezius. She was having cervical spondylitis also. So I inserted a needle over the trapezius. And then when I went down near the gluteus, I inserted the needle because gluteus was taking one-sided because she was having one-sided. She was walking one-sided. So immediately I strengthened the other gluteus area because she was walking limpingly like this, ting, like this. So one side became strong, one side was taking overload. So because of this overload, our biomechanics was disturbed. So now you can see the pain is what? Subsided. You can ask me questions.
How long is that?
Tomorrow I'll show you by NIBS how did I recover a paralysis patient. You can ask me questions.
Good evening, Sarji.
Hmm.
So, because gluteus muscles were affected, you have treated.
Yeah, see, not only gluteus, the paraspinal area, she was limpingly, she was not putting pressure on one side, she was putting pressure on the other side. Now, if I don't balance both the muscles, your muscle knowledge is also important. If I don't induce strength in quadriceps lumborum, QL. Because QL is the longest muscle, and I go strengthen the paraspinal muscles. What will happen? Now let us go to the back muscles. Go to the muscles of the back. In Google, back muscles of Google.
You want muscles on Google, sir?
Yeah, back muscles are on Google.
Back muscles.
Back. Back muscles. So you could go to first image. Third number image you can take.
This image, sir?
Yeah. So longissimus thoraci muscle was important. Iliocostellus lumborum muscle was important to revive her pain. And spine is thoracic muscle because she was putting more pressure on this. So when you use these three muscles, along with one more muscle was there. Put second picture. Second picture. Or third picture, 1, 2, 3. Fourth picture on the first row. Fourth picture on the first row. Fourth picture on the first row.
First
Fourth.
picture, okay.
Fourth.
Fourth. So major muscles she was affected was abductor magnus, tensor fasciae latae, iliovertebral tract, and carpus flexor ularis. No, not gluteus. And the muscles nearby the paraspinal, which I already mentioned. So I used this NIBS and I inserted the needle instantly, and you can see that area got instant strength, and she got what? Recovery in.
Immediately.
So the principles of TCM and integration of neuroanatomy and muscle anatomy recovers what? The patient on the table. She was so confused to say me whether she took tablet, she did not take tablet, what to do, what tablet she took. She was so confused. Now you could see, just by putting few needles in 5 minutes, how beautifully you recovered this patient. You may ask me questions.
So in this type of cases, distal points will work more or local ones?
See, it is not about the distal points or local points. You should diagnose why the patient is having pain. That's what I said. This is the biggest mistake you are doing in our whole theory, that you are running after the points. Why I selected these points? I told you the history of the patient. For example, you eat some cold food, right? And after some time, you'll have a lot of low back pain. There is no disc prolapse. How to recover then? You have to increase the yang. At that point, you have to increase to those points by which yang can be increased and the pain can be reduced. Understood?
Excuse me, sir.
Yes.
Good evening, sir. So, whatever we revive for the pain, how many sessions we have to go for it, sir?
See, it depends on this case, what kind of lifestyle she lives. Otherwise, this type of patients, sometimes in one session, 2 sessions or 3 sessions, they revive. But this type of patient, generally, they need to be supervised for 1 month because it's a neurosurgical case. She need immediate neurosurgery.
Okay,
We
sir.
had only two choices, either go to a neurosurgeon or go for this treatment.
Okay. Thank you, sir.
Because how long she will be on muscle relaxant and painkillers?
Yes, sir.
And it was after every 2 hours, 3 hours, you are taking this. So how will it subside?
Yes, sir.
There is the power of dry needles. This is what I said, that how dry needles can help you to recover large number of patients without what? Surgery, and it has a huge scope for internal medicine. It has a huge scope for many things by which you can understand point wise also. I gave you the points also. But more importantly was a deep spasm which was existing there. So when I inserted this needle Li4 and all, it inserted endorphins and corticosteroids. These points are famously for that. And then
sakit naman. Ale, sigaw. Ale.
Vilma from Philippines, please mute your mic.
so now you can understand how you can recover many diseases, even in CKD and all, you can recover many diseases.
Pradam sir, Mukesh Raut from India. Sir, for diagnosis.
Pardon me?
You are muted.
Muted, I'm speaking.
Mukesh, please.
So, how we will diagnose the?
I diagnosed it by MRI and then I spoke to the lady. What is our lifestyle?
No, sir. How we will diagnose in TCM? You will take further classes on that.
Yes. Already we said, by the taste of the food, by the smell of the body, by our likes, by dislikes, sleep, bas.
Yes, sir. And so, yin and yang, what color we have to be look?
Can you give me just 5 seconds? The battery is over. Just give me 5 seconds. I'll change the battery.
Okay, thank you, sir.
Can you hear me now?
Yes,
they
sir.
can.
Yes, sir.
Tell me what you want to ask.
Yes, sir.
Tell me.
So,
See,
I am asking what color we have to be seen for yin and yang? Bright and dark.
it always goes for the darker side. Whatever the dark, the skin will go to the darker side. So now in Nigeria it becomes difficult because the skin is dark. But then the sign of the color,
Okay, sir.
The major is the taste, color, emotions, and anxiousness. If I don't put PC6 in heart 7, she's not going to come tomorrow because she's anxious. Fear. So the fear of the mind is cooled down. It could be cooled down by
Okay, sir.
just by putting by liver 3 also.
Thank you, sir.
So you have to work both ways, emotionally and physically, to stabilize the patient, because whenever there is a severe pain, continuous pain, which is not recovered by painkillers, you use this type of system and the patient recovers immediately.
Good evening, sir.
Uh,
I'm Alpana from Bangalore, sir.
Chinmay Alpana.
Yes, sir. When patient come, like this type of patient come, you directly go to scalp, or first day we have to
No,
go
no,
through
no.
other.
I don't go for scalp or anything. There is no idea inside my mind. I choose everything as per the history of the patient.
Depending on prognosis, we have to.
No, you are saying prognosis is the means after treatment. It is a diagnostic pattern. 1, 2, 3, 4, 5, 6, 7, 8. How loud he is, how much pressure they are having on their head, how much money pressure they have, how much financial loss they have made, how much loss he is making. All these things creates the disease. It is why I said emotions, adrenaline, all those things what we do creates a problem. Now solving them one by one, then only patient will revive. Otherwise, patient runs away. My first work was to induce endorphin and corticosteroid. I used LI4, LI11, and then I stimulated with my fingers immediately. Then I used the local points. Then I used SP9, SP6 to nourish the in, because SP6 is a passing point to many channels. And you see, patient, now she is my permanent patient. Now, what she will select? She will select neurosurgery or this treatment?
This treatment, sir.
Yes. The perfectness of your treatment only will decide which treatment people want to select. Only it has to reach the people. Most of the people don't go for surgeries because it has a lot of money and post-operative complications. This treatment has no complications. Patients revive. They revive on the table, maintain their lifestyle. Within few days, they can go to their normal life. Cheap, best, and good.
Sir, this patient have the problem only in the morning, 1 or 2 hours.
Morning stiffness. It is called morning stiffness. So morning stiffness also can be reduced by the same procedure, because the muscles are weak. Now you have to identify which muscles are weak, and then you have to check his slippers, how he is walking. So you have to identify which muscles are weak, strengthen that muscles by NIBS, morning stiffness will go away.
Thank you, sir.
I told you it is very easy method. Easiest of the easy. Where
Yes, sir.
neurosurgery and where this?
Excuse me, sir. Sir, can the system help in balancing hormones, sir?
Yes, you could see. I'll show you a report tomorrow. I have revived a patient through NIBS in 15 days. the thyroid has become normal. She was hyperthyroidism, hyper. Now she's gone. Her thyroid is become normal.
Okay.
Although I requested her to continue tablets, but with after conservative treatment also she was not feeling relief. So somewhere stress is also associated. I work with stress points, PC6, heart 7, somewhere in the NIBS, and liver 3, SP9, SP6. They recovered in 7 days. I'll post a report tomorrow.
So, for example, if a lady she is habitual abortion, she has habitual abortions. So, can we increase the progesterone or such?
It all depends on what method and how much you are trained. Because during the treatment procedure also, you will get complications.
Yes, sir.
Are you capable of maintaining those complications? Are your foundations are capable of maintaining the complications?
Okay. So, can we revive PCOD?
See, I'm not a gynecologist, so I don't use much. But 2 patients recently which I treated with PCOD, they have been normal now. Up to now, they are normal.
Okay. So, because in allopathy, there are lots of side effects for this PCOD.
The one whom I have treated, they are normal up to now.
Okay, so thank you.
Since I did not study much of gynecology, I'm not able to say, but this is a yin disease, and I maintained it with the help of Yang. And then patient depletion of Yang yin and was supported by what? When the yin is weak, give power to the male. There are only 2 powers in the body, male and female. Give
Yes, sir.
one is weak, one is strong. So one
Yes.
who becomes weak, you can give him power and the patient becomes better. Am I right?
Yes, sir.
So more questions we have? Focusing more on the practical part. I don't want to go with more theory. All of you know theory. Go to Google and you'll get all the theories. But main classification, what is taught in Nanjing University, and how you use this classification in recovery of the patients, where a large number of amount can be saved. You can revive the eyesight, you can revive this, you can do this, you can do this.
So can you show us live, sir, on certain
About
patients?
what?
So
Which
some
kind of
special-
patient? This patient I've shown you live only.
Yes, sir.
Tomorrow I'll show you how I treated NIBS live.
Okay.
Exactly, you will see how I inserted the needle and how I stimulated.
Sir, there is one patient who is having moderate to marked mucoid degeneration of the ACL. Anything can be done in this method?
You are saying about sports injury, huh?
Yes, sir.
See, in this case, you have to see what we can do, because this type of cases, sports injury cases do not come to me. I'm not known for sports injury. I'm known for typical neurodegenerative diseases like motor neuron disease. I'm known for terminal stage diseases.
Okay, sir.
But one thing can help, PRP. Did doctor suggest surgery?
Yes, sir. Mild OA of the PFJ and mild superficial plus deep infrapatellar bursitis is there. But the
This can be
patient is not.
recovered. This can be recovered, but then you must know how to insert the needle closely inside. This can be recovered.
One doubt is if the ligament is degenerated, like it has.
Ligament can be, see, if it is not there, it can be revived. I have revived a fourth stage lady who even could not walk. Now she is walking freely. 80% of the pain has been subsided. That is what I was teaching you during knee pain procedures.
Yeah, that's why I got an interest. If the ligament is having some infection, like it is going to deform some 60-70%.
Infection. It is infected.
Like in the degenerate, what I'm saying is
No. Infection is different. Degeneration is different. Are you speaking about infection or degeneration?
Mainly degenerations. If it is some 60-70%.
Can be revived.
Okay.
So for osteoarthritis for good, what we have to be planned?
See, osteoarthritis, you have to plan 4 things. First of all, the strengthening, which kind of pain she is having. I told you, different types of knee joint pain. That is why I say, don't think about osteoarthritis. See what kind of pain it is having. It is because of quadriceps, it is because of back pain, it is because of soleus. Right?
Okay, sir. Yes, sir.
So when you recovered today, I got a severe knee pain. I was saying, there's no problem. Mild osteoarthritis, why the pain is there? I touched the soleus muscles, back pain. I said, oh, she's having severe pain. I inserted the needle, touched the pain, removed it, and the pain is finished in 1 minute.
Good
I
evening,
told you
sir.
the point yesterday. You must see how the patient is walking.
Okay, sir.
Understood? Walking style, it is called biomechanics.
Yes,
if you understand the biomechanics, you can understand many things about the body, especially the walking style of the patient. How much compensation is taking from which area, and that compensation, if you strengthen by NIBS, the patient is recovered. Does not need to go for surgery immediately. Many such patients are there. At the age of
And
70, 80, they don't want to go for surgery.
yes. And no need to think about osteophyte, sir?
No need for all those things thinking.
Okay, sir. Thank you, sir.
Degeneration, pain can be subsided, patient can be revived. You only need to strengthen the muscles, find out the cause. Osteophyte is little bit there. In every knee, you will find an osteophyte. That does not, if your muscles are powerful, they may manage the osteophyte. Up to now, the only problem with you was that you do not know how to strengthen the muscles. Right? You used to use lot of exercise and massage, this, that. Now it is very easy. Put the needle, test the pen, topic over.
Okay, sir. Thank you, sir.
Tomorrow also you have recovered a paralysis patient in just 4 minutes. Right?
Excuse me, sir.
Yes, sir.
पेशेंट में स्कॉलियोसिस के पेशेंट में स्ट्रक्चर भी चेंज कर सकते हैं, मतलब जैसे एक तरफ
नहीं
से
अभी
वो
किया
bend हो
यहाँ
जाता
पे जो आईजीपी है, मैंने उनके बेटे को 80 डिग्री स्कॉलियोसिस था, उसका रिकवर किया है. Now it is only functional scoliosis. You can see it before X-ray also, after X-ray also. He was IGP low and all this. He's an autistic child. फिर भी मैंने कर दिया.
Okay, good.
मैंने infantile spasm, उस बच्चे को मैंने 90% रिकवर किया है. Any more questions? So if you see TCM cannot recover the patient, it is wrong. Meridians cannot recover the patient, it is wrong. It is only our diagnosis and understanding and repeating of the same point, what Avindi Silva or this Jay Surya has written in their books, just repeating, copying and pasting it from the Google. We have become a compounder. We do not know how to see a disease. We do not know how to understand the anatomy of the damaged area. And that is why we cannot recover a what? Patient. We all have become a compounder, an assistant, or RMP. We have to become a physician. You understood?
Yes, sir.
Instead of repeating points, you must diagnose and prescribe and recover it on the what? Spot. Am I right?
Yes, sir.
Yes, sir.
Yes, sir.
Very
In this way, you can recover motor neuron disease and all. You can sustain a long time in these diseases. You cannot leave them on die. Right? Paraplegia, quadriplegia, you can recover. Clear to all of you?
Yes, sir.
Clear, sir.
Any doubts? Then I'll teach you. Let my whiteboard come and then I'll teach you how 5 elements help you to work with Korean acupuncture theory. In this, we learn theory and prognosis and treatment. By putting 4 needles, you will see 80% of the disease pain is gone.
Very interesting.
This is what I say, it is interesting. Only we made it uninteresting because we focused on what? Points. Otherwise, it can help large number of poor people, those who don't have money. It can help large number of people from surgery. It can help large number of people from bedridden stage to a normal stage. Today, I got a patient who is having a cervical tumor who cannot be operated and bedridden. I accepted the case by the help of what? NIBS, I will make him walk. Even the cord is compressed, he will be able to walk and he will be able to live his life.
Sir, actually, want to learn this.
So you are learning only. What are you doing? That is why I say increase the number of people, be united, learn more, discuss more. That is why I encourage you to ask questions first. Because your doubts of your mind only creates poison. Once your poison is cleaned, you are a clean mind. Now you can select things and then you can understand. First, remove what? Points from your brain. I gave you these points because you will think, oh, what did I get today in the class? There's no use of attending the class. So I recorded this recording and I show you, oh, from 0 to the final stage, you can see patient revive immediately. And tomorrow you will see how I revived a paralysis patient who came with a lot of difficulty, started climbing staircases after 10 minutes of treatment. Leg muscles can be very easily recovered, hand muscles takes time. Right?
Yes, sir.
Any more questions? Any more questions?
Any updates are about NIBS? New updates?
Yeah, I have updated NIBS. That is another thing which we'll discuss with the whiteboard and all. We'll teach you about the muscles and all. Again, you have to revive about a lot of things. So I'm teaching you about pain management with dry needles. I taught you how to do it with dry needles. Now I'm teaching you with how to revive instantly and quickly with the needle. And today I got the whiteboard also. From tomorrow, I'll teach you on the whiteboard little bit, and then you will be able to understand many things. And then you can understand a lot of things. Tomorrow, I'll teach you how to recover 20 symptoms with the help of 5 elements. Just select. Without only 60 points are enough if you know properly how to recover a patient. So, spread this knowledge and learn this way of recovery of the patient. Right?
Right, sir. Thank you so much.
Thank you so much, sir.
Thank you, sir. Thank you, sir.
Thank you, sir.
Prakash ji.
Thank you so much, sir.
Prakash ji.
Thank you.
Thank you, sir.
Prakash ji.
Prakash
Prakash ji,
Thank you so
please.
much, sir.
Prakash ji. Prakash ji. Prakash ji.
Thank you, sir.
Prakash ji, please. Answer, sir.
maybe he's not near the system, sir.
I think he's busy with yes, lot of things to do. Anyway,
It's
thank you so
possible,
much.
sir.
Thank
Have a
you all
lovely
of you,
night.
Khalid. You may
You're
close the
welcome, sir.
class now. You may close the class
Thank
now.
you so much, sir.
Thank you so
Terima
much.
Thank
kasih
you,
banyak.
everybody.
Terima kasih.
Thank you so much,
Everybody,
sir.
thank you so much, sir. Night, everyone.
So much, sir.
Good night,
Night,
everybody.
everyone.
Thank you.
Thank you,
Thank
everyone.
you.
Good night, everyone.